All right, it is 5 o'clock. Thank you, Kentucky, for tuning in again to make sure that you are a part of this Team Kentucky and everything we are doing to defeat this coronavirus. We are in this. We are in this together. Every time we say it, we feel it just a little bit more, and we know how true it is. So say it with me. We are in this. We are in this together. One last time. We are in this. We are in this together. We're in this together because we know what it takes to defeat this virus. And I know now that we're over a month in and really even close to that amount of time for being healthy at home, we can feel a little anxiousness. But I do want to point out again that this being the challenge of our generation makes us think about that greatest generation. And later, I'm going to talk about another person we lost from that generation. Remember, when they faced challenges, they were able to come together with uncertainty and anxiety, with families not together at home, but my grandfather was with Patton's Army in Europe for a period of time, separated from my grandmother. They were having the difficulty of not, as a family unit, being together for years of facing what they faced. We can do this. And we can do this in a way that protects people. We just got to make sure that we make the right decisions, that we're careful about how we do it, and that we always focus on making sure that we are saving lives. And you are doing an incredible job. I'll talk about that in a minute. You're primarily doing we're in this together, and I'm not the only one who wants to make sure that you know that.
We will get through it together.
All right, just a few more of that next generation that Virginia has had a major impact on, making sure that everybody is included. We're going to get through this because we're going to follow the 10 rules that helps us defeat this coronavirus. And think about what's happened. We had a virus spring up really at the end of the year that no one had ever seen before. It spreads fast. It can be deadly among certain populations. There's still no vaccine. There's so much that we didn't know. We learned this new acronym of PPE. We had to create a set of tests that had never existed before. My goodness, the resources weren't there to fight this new virus. But what have we done in flattening the curve, in reducing the potential deaths to date by thousands or tens of thousands, just in Kentucky, that I think we'll see? We did it because we followed these rules. We have to date engaged in social distancing at a level and to a success rate that I don't think that we have seen in human history. And that's because we have more knowledge, but we also have better means to communicate. We had partners in the media and so many other places that got the word out, and then you did the right thing each and every day. We almost only had one tool in our toolkit to start this battle. And y'all rose to the occasion, and we got to keep rising to the occasion. Staying healthy at home is the way we beat the coronavirus. Again, every healthcare worker that's putting their lives on the line every day will say thank you for the other help. But the number one thing that you can do for me is to stay healthy at home. You ought to be at home unless you're getting some exercise, and it was a beautiful day. We're going to have some beautiful days. Get exercise. Don't use it as a reason for a social hour, but get exercise because we want you to be physically and mentally strong. But otherwise, if you're not getting groceries or something you need, be at home. That is a heroic decision. That saves lives. That ensures that next senior living facility doesn't have a new case. Every decision you make impacts other people around you. We need you. We need you to be making those right decisions. Avoid crowds and gatherings. There aren't any exceptions to that. We'll talk about that in a minute. Practice social distancing. Apply for benefits. We're going to have an update on unemployment here today. Do not travel. And this prioritizing your mental health. I've talked about how tough it is, and I've tried to make sure that I use technology a little bit better to connect with people. Just like with what you all are going through, this has been pretty isolating on me. But doing this and actually reaching out to people and talking to people through Zoom or other things has got me feeling better. And that's what we all need to make sure that we're doing. We always talk about the top 10 rules plus one more. Please fill out your census. I'll make you a deal. If we can go up by 2%, 2% by tomorrow, that's just 2% of all Kentuckians filling it out. I won't talk to you about the census for the next 3 days. But this is so important to how we rebuild. And if I have to, I'll propose something else to get people to do it. This is a legal obligation. It's actually against the law not to fill it out. Let's make sure that we do it. This is part of Team Kentucky as well. And every day we ask you to take the great things that you are doing and to put it out there for all the world to see that Team Kentucky is united, and we are, more so than ever before. And let's make sure that the good decisions that we're making, other people see. We've created such a positive momentum for people to be a part of a team, together KY, doing their patriotic duties, being healthy at home, and we have got to keep that up. As the days go on, other people get online, they look at this, and it helps them to get through their day. This is also part of our taking care of our mental health. It's about being there for each other and connecting even with people we don't know. When we put something positive on social media, it's out there for somebody who needs a laugh, a lift up, to see somebody's dog or somebody's cat. And they're all positive and they help everybody. So let's look at what we got today. All right, this is in Mayfield. And this is one of our senior living facilities. Yes, our heroes are working at those facilities. What's incredible is, almost without exception, even when we have an outbreak of the coronavirus in these facilities, guess who shows up every single day? The staff. To care for their residents. Yes, they're heroes here. All right. We've talked about how these green lights, and look at all of them, aren't just individual houses anymore. They're whole neighborhoods, whole communities, institutions. It's a sign of not only our unity, but our compassion. This has proven what good people we are in Kentucky and how much we love each other. I think that's the right word. How much we love each other. Let's make sure that just because the days mount up and just because we want to get back to the old normal or at least a new normal, that we don't remember this compassion is one of the things that keeps us going, and it reminds us of renewal too. There is a better day ahead. All right, this is the Bowling Green Little League team that, again, wants you to stay home, healthy at home, and wash your hands because Bowling Green East wants to get back to playing baseball. The better we do, the sooner we are able to get to this. And we're missing out on a lot of special moments and opportunities for our kids. I tell you a little bit about my kids, but everybody's kids out there are missing out. And the better we do at this, the better chance we have that we don't have a spike in the fall and lose more memories, and the better chance that we have those around us who are most vulnerable to experience these memories. This isn't just about these kids wanting to play baseball. It's about everybody who wants to come to watch them, being here still with us to watch them. This is Buffalo Trace Distillery, and I know all of our distillers are now making hand sanitizer. It's been incredibly helpful. It's turned something we were out of into something that we can provide others, but we appreciate everybody doing their part, including Buffalo Trace right here. All right, these are some of our healthcare workers, and again, this is what they're asking. This is EMS. They're doing their job. They want to help those that are even contagious, but all they ask you to do is to stay at home. Now, they're doing their part. Let's do our part. All right, we continue to have to support our small businesses, including our restaurants. I haven't talked about this in a little while, but we need to be ordering takeout to help support them. That's part of our patriotic duty, too. This has been one of the hardest hit areas. I understand that. So let's continue to try to reach out and to support them. And this place makes great wings. Here is just a little bit of the Kentucky Derby would have been coming up. First Saturday in May. I know we got lots of digital activities that are out there. These are the types of things that can enrich our days and find constructive things for us to do. And here's Dawson Springs, a little slice of heaven in Hopkins County, and what their school district is doing to make sure they're protecting their kids. And while there's a little depth issue here, we were able to look at it. There is social distancing. They are wearing masks and they are wearing gloves. This is a great superintendent, and we appreciate the work that he and all other superintendents are doing. Just because kids aren't in school doesn't mean they're not providing instruction and care and food. Our superintendents have been phenomenal leaders during this, and I hope they know how much we appreciate them, all their teachers, all their staff, all the bus drivers, everybody who normally works in the cafeteria, the custodians that are keeping it safe. Everyday heroes doing extraordinary things in a difficult time. All right, so the next message we have is another message for Team Kentucky, a fund that's going to help us care for people out there that have been harmed by this virus. Today, we got Justin Thomas, PGA golfer from Kentucky, pride of Kentucky, has won a major and does us proud each and every day. So here's Justin.
Hey everyone, it's Justin Thomas. I'm coming to you from my home in the midst of this quarantine with an important message. I know that so many of you have made sacrifices to stop the spread of coronavirus. For some, this has been harder than others, and many people in Kentucky have lost their jobs. But because this is Team Kentucky, I know we are all going to be able to come together and help each other out. And one way we're doing that is through something called the Team Kentucky Fund. The Team Kentucky Fund is just like most popular fundraising platforms. You can log on, click a few buttons, and give instantly. I'm inviting all Kentuckians, Kentucky businesses, and friends of Team Kentucky to make a contribution just like I just did. I'm challenging you to give at least $19 to the fund and then post about it with the hashtag Give19KY. There are no limits to what you can give, from $1 to $1 million. Every penny will help. So chip in what you can, and also, your donations to the Team Kentucky Fund are tax deductible. So, like I said, go to donate.ky.gov right now and give what you can. Thank you, Kentucky. Stay safe. We can get through this together.
And thank you to Justin Thomas. We are very proud of him, just like we're very proud of each and every one of you. Now the part that's added a little something to all of our lives, the opportunity for us to learn a little bit of sign language to make sure that we include everyone. And our phrase for today is okay, good mental health. Let's do it one more time. Good mental health. That's what we are all aiming for to get through this. Good mental health. Thank you. All right, so I know some of our biggest news for today. It shouldn't have been a surprise. It's something that virtually every state now is having to do. Ohio, Indiana, even Tennessee announced it. And that is my recommendation that we not have in-person classes through the rest of the school year. This is not just looking at our experience and where we are right now. It's also providing the White House. It's also following the White House's guidance. As you remember, we first have to hit certain, we'd call them benchmarks, but prerequisites before even entering their suggested phase one. And in their phase one, they still say that schools and daycares and other youth endeavors ought to be closed. So it's every healthcare professional had advised us that this is the right course of action to take. Now, I know for many, this is hard. We had seniors that were looking forward to an in-person graduation and a prom. I've got a son who's graduating from elementary school. And we have every student out there that has lost this time to be able to be with their classmates and there for in-person instruction. But we are asking all of our schools to continue the non-traditional instruction. And it's very helpful for our kids. It gives them an outlet. It keeps them intellectually challenged and to keep up the food service as well. This is something I think our superintendents were expecting and were planning on. They've provided great leadership, and I know that they will continue. And to those seniors, it's going to be a little bit harder because it doesn't look like at this stage we're going to be able to have a regular in-person graduation and certainly can't have an in-person prom. So what we're looking at right now are opportunities to do this virtually or perhaps through some type of drive-in service. And it's not fair if you're watching. It's not. But a worldwide pandemic has hit us. And those of you who are missing out on these opportunities, we need your help and we need your sacrifice. And ultimately, the experience you're losing is hard. But your willingness to do it is going to help us save lives. And regardless of what age that you're at, whether graduating from an elementary or a middle school, a high school, or even a college, this shouldn't have to be asked of you, but it is. This is a time that we are all called on to do more than maybe we ever thought we could, but knowing what the stakes are. So to all of you, I understand your disappointment, but thank you. Thank you for your willingness to help other people, and let's find creative ways, digitally and otherwise, to try to celebrate your accomplishments. Just because you might not be there for an in-person type of service doesn't mean that your achievement isn't just as amazing. So I look forward to all the creativity that we will see from our wonderful students that are out there. And we will reach a new normal, and life will not be like this for years, not even for months ahead. We have months to go. We'll get there, and I think that you will look back, and I think what you'll be able to say is, no, in that year I wasn't able to do what everybody else had been able to do before, but nobody else could say that by having their graduation differently, they protected people's lives and their health. And each and every one of you that's giving something up are doing exactly that. We appreciate you, and that's a gift to Kentucky and to humanity. All right, so next we've got an update on unemployment. And for that, we are bringing in our Lieutenant Governor, who is also the head of our Education and Workforce Development Cabinet. Hi, Jacqueline.
Good evening. How are you, Governor?
I'm doing all right.
Good, good. Well, thank you. And before I start, let me just say that I have two seniors in my home. One's a senior in college and one's a senior in high school. And so my heart goes out to the class of 2020 this year, and just know that we're all thinking about you. And I know and I trust the adults in your lives and in your schools to make your graduation as special as they can. So that being said, I want to give you an unemployment insurance update. We are continuing to process an unprecedented amount of unemployment insurance claims and payments. Just to give you an idea, we have processed twice as many claims since March 8th as we did in all of 2019. Still today, we are averaging about 13,000 new claims being filed every day and about 25,000 phone calls coming into our offices every day. The main point that I want to make today is that if you have applied for unemployment insurance, do not reapply and do not open another claim. When you do that, it causes your claim and others to slow down, and it causes payments to be delayed. So if you hear nothing else about unemployment insurance today, do not reopen a claim and do not apply for a new one if you've already applied. We have put a team in place who will begin to go through the reopened claims and the duplicates and to try to weed those out so that we can make sure that our system is working quicker to help you. The only people who would need to apply for additional support are the people whose original benefits have expired. So if that's the case, you can reapply. Otherwise, please do not, because it will only slow it down for you and everyone else. I want to talk to you about a couple areas that we're working on to improve this week. The first one is that we are reaching out to all of the folks who are past their 2-week period to receive payment. They are our number one focus this week in our offices. And secondly, we are working to train an even larger number of folks for our UI staff so that we can continue to handle those complex issues that keep coming in. The progress that I can report is that we have hired over 1,000 people for our call centers that used to have 12 people in them. While 2 weeks ago, we could only take on about 1,200 calls a day. As of this week, we are now taking on 25,000 calls a day. We are able to actually take on those calls and answer them. Our wait time went from 2 hours to 6 minutes. So we are working diligently to help as many people as we can. A lot of the questions that are coming in are, when can I expect my payment? And so what we've done is we've set up an automated call system that will update you on when you can expect your payment so that those folks don't have to continue to call to ask that question. We made about 6,000 of those calls this week. I feel good about the fact that we're starting to turn a corner and being able to take on more calls and more claims are being processed. But I want to assure you that we are working diligently to help those of you who are still struggling. I know that the folks in the Education and Workforce Development Cabinet, especially in the Unemployment Insurance Office, get up every day worried about you and eager to help you. And so just know that they are thinking of you and they are working really hard to help every single Kentuckian who needs it. Regardless of how much progress we've made, I will be the first one to say that it is not enough until every Kentuckian has what they need. So we will continue to work as hard as we can and try to be good teammates on Team Kentucky, Governor Beshear.
Thank you, Jacqueline. And
Thank
before
you.
you go, tell us how baby Evelyn's doing, because you are going through this worldwide pandemic with a new one at home.
Yes. So in addition to having a senior in high school and a senior in college, we have a 10-week-old at home. She's doing well. She's probably doing better than the rest of us, honestly, but it's given me some good time with her. But the downside of that is the grandparents don't get to hold her quite as often as they wish that they could right now. But she's doing great, and thank you for asking.
Thank you very much, Lieutenant Governor.
Thank you.
All right. I think very important news coming out of that I hope everyone's excited to hear, and it's certainly the right thing, is that the prioritization is going to be those that are 2 weeks over when they should have received their first payment. So I hope everybody out there agrees that is one area that we definitely need to be focusing on. And like Lieutenant Governor Coleman said, until all of you have been helped, we haven't done our job. So I think I say this just about every day. I'll take responsibility, even though it is it's required a level of staffing we've never seen before, and it's a level of claims that no one has ever seen before. Our job is to do everything we can to help, and we're going to get it done. I want to go to our benchmarks really quickly. Tomorrow we're going to be announcing some internal teams that are going to be helping with this. Remember 14 days where cases are decreasing. Now, this is either the number of new cases or the rate of new cases. In other words, as our testing increases significantly, and next week it's going to. Next week we hope to have close to 4,000 tests done just from our drive-in locations. We'll talk about those in a minute. That add 10% on top of where we are right now. So with that, we expect to see some more positives. So we're gonna factor that in. We also have to adjust for weekends. Like when we read today's number, it's because many labs were closed yesterday, and so, well, thankfully, but it's probably artificial. We have a lower number of new cases today. Increasing our testing capacity and contact tracing. I believe we've got some momentum on increasing our testing capacity. We got to do it by a lot, but we have a lot of folks in state stepping up for it. Working on a couple of new partners I hope to be able to announce on Wednesday. Working on some more in-state capacity as well, and I hope we can put some new numbers with that. We gotta significantly increase this. Contact tracing, again, we're going to be rolling out a plan on how to hire a significant number of people. It's going to take a significant number of people. So where we want to be able to get to in the future, how we're able to open up safely is, you do the temperature checks as people come into their place of business. Anybody has symptoms, they immediately go and get tested. They test positive. We're able to do contact tracing and then get those people in for a test as well to try to put a bubble around how far that we think that spread has gone. That's what the future looks like as we reopen, which requires both of those, and we'll be able to report on how many we got to hire and where we want to see that testing capacity to get to. But remember, these are just benchmarks. As we do really well on one of them, we may be able to make up for not being exactly where we want to be on another. For instance, if we have really great plans as far as CDC guidelines and the rest, we might not be all the way to the testing we need, but at a place where we're able to make it work. PPE, incredibly important, and we're continuing to do everything that we can there, and we'll be really interested in working with business about what their availability is going to be able to do. At-risk populations, we'll talk today. We have additional cases in nursing homes and senior living facilities, and a number of the deaths we announced over the weekend are from these facilities. This always has to be top of mind. This is, again, going to be really important as we go forward in a world where we're reopening at the same time that this virus is still here and still very contagious. It's going to be a different world. I talked today in an interview about what a wedding would look like and how many people could be there if done at different periods of time. I just hope people to get in your mind what the world's going to look like until we get towards a vaccine. I mean, a wedding's going to include people wearing masks. It's going to include smaller numbers of people, and you're not going to be able to get really close for that shot that everybody wants of the bridal party or the wedding party. That's the new normal until we move towards the vaccine, and maybe just that visualization tells us about how things are going to be a little different. Got to make sure in that St. Louis graph that we don't have that second spike where we lose more people in the first, and in fact, we don't want a second spike at all. And then, of course, how close we are to a vaccine or really effective treatments could change everything. It's our obligation to make sure we're protecting each other until we hit that point, but we could see if there's a widespread vaccine that becomes available in the future, how we get to our old normal. So, as we talk about increasing testing capacity, that means we've got to take advantage of the tests we have out there. Starting tomorrow at 8:30, we have testing in 4 locations through our drive-through testing. And those are in Pikeville, in Somerset, in Madisonville, and Paducah. And we need to make sure that we test every single person that we have capacity for. I will tell you, most of the areas, especially the Western Kentucky areas, are filling up really quick. We need more sign-ups, especially for Pikeville. And then in day 3 and 4, in Somerset as well. It's really important for us to be able to test as many folks who fall into these tiers and categories as we possibly can. It gives us better data, which is going to help us reopen earlier and safely. And so let's make sure we take advantage. So this is on our website. We've got a lot of local leaders that are out there trying to encourage people. Let's take advantage of testing in your area. The better we can do on this, again, the better information and maybe even the earlier, we're going to be able to reopen different things here in Kentucky. It's where we all want to get to. We just want to make sure that we do it safely. All right, so our numbers for today, we think are a little artificial because a lot of the labs were closed yesterday. As you know, we reported the single highest number of cases yesterday. Today's down significantly from that. So today we're reporting 100 and new cases. We're reporting 102 new cases of the coronavirus. And after we remove duplicates and patients that don't meet the definitions, our new number of total cases is 3,050. So we have gone above 3,000 cases, a place we always knew we'd be. In fact, we thought that we would have significantly more cases by this period, but you have flattened the curve. You're passing that test of humanity, and you are protecting people. Our largest lab in the state now by volume was closed on Sunday. And so we'll look as we get results tomorrow to see if this is balancing out on both days. But even as we looked at yesterday's number, while it's high, we still feel like we may have even plateaued in the state. And that would be good news if instead of continuing to increase, if we have flattened the curve into that flat line that won't look like a flat line. It'll be up one day and down another and up one day and down another, but really average into that flat line. If we are there, that's great. But remember, what the White House has said and what we know is we need 2 weeks of actually going down. But you can't go down until you stop going up, and you can't go down until you've at least flattened out. And so I'm where we are is so much better because of your work than where anybody I think has ever been dealing with one of these worldwide pandemics like that. And for that, we're eternally grateful. Total number of tests in the state, we can confirm over 32,830. Kentuckians ever hospitalized because of COVID-19, 1,017. Currently hospitalized, 263. Ever in the ICU, 532. Currently in the ICU, 147. Let's think about those individuals. And number recovered, 1,134. Cases by new county, Jefferson with 56, Graves with 12. Again, Western Kentucky hit hard. Kenton 7, Warren 6, Davis 5, Grayson 3, Campbell and Jackson and Marshall 2 apiece, and 1 in Adair, Boone, Breckenridge, Fayette, Hopkins, and Muhlenberg. Now we are reporting today 6 new deaths. And we're thinking about these families. We're going to continue to light our homes up green to let them know that they are not alone, to show the color of compassion and of renewal, of caring about their families, whether we know them or not, and believing that the body is just a vessel and that spirit is going to an even better place. The 6 that we have lost include a 59-year-old female from Crittenden County, a 92-year-old female from Adair County, a 64-year-old male from Jefferson County, an 85-year-old female from Hopkins County, 62-year-old female from Jefferson County, and a 76-year-old female from Jefferson County. That means we now have 154 deaths. Wasn't that long ago that we passed 100. That's why our flags have been flying half-staff through the last week. 154 is a milestone that nobody wanted to hit. And so tomorrow we're going to do a presentation of wreaths in front of Lincoln here in our rotunda by KSP's Honor Guard to honor these first 154 now folks that we have lost to the coronavirus and in honor of their families as well. We're going to make sure that we video it and we will show it tomorrow at 5. Again, just a way that we can try to be with folks that this pandemic has taken. And we also know that more folks, a lot more Kentuckians that are loved by their families would be gone right now, but for each and every one of your actions. I hope when We get to this point every night. And again, we look forward to that night and that 2-day period and that 3-day period and that week period where we don't lose anybody to this. And we can get there. But it continues to take our commitment, knowing that this could be our family, and we keep hearing from others where it is their family. And tonight, and I'm looking through my notes, we wanted to make sure that we mentioned a specific Kentuckian. Crystal, can you grab those notes for me while I go through the ethnicity? So in race and ethnicity, which we break down each and every day, we know the ethnicity, and I found it for 76% of all Kentuckians, 76.93% of all cases white, 13.67% Black or African American, 4% Asian, 5.28% multiracial. In ethnicity, overall cases, 92.49% non-Hispanic, 7.51% Hispanic. In deaths, where we know about 80% of the racial data, 75.61% white, 21.96% Black or African American, 1.63% Asian. Again, something we have to do a lot better on. And on Wednesday, we're going to have an announcement on how we're directing a lot of resources and more so than we've done in any of the locations we've announced to try to provide help. We're not going to solve hundreds of years of inequality and unequal access to health care in the middle of a pandemic, but that doesn't mean we can't do more, and we're going to. Ethnicity of deaths, 99.17% non-Hispanic, 0.83% Hispanic. So tonight specifically, we're remembering one of those that we have lost, William Dean Smith. He is another hero of the greatest generation. He's a loss for Kentucky and for the generations of lives that he changed in Grayson County. He was 96 years old. And with the passing of Mr. Smith, which is Grayson County's first loss to this virus, the community also lost a mentor and life-shaping force whose influence was felt among a cross-section of people, said Ken Howlett of K105. Ken also wrote, in a community full of difference makers, William Dean Smith stands out, for he was more than a war hero. He was a mentor and a teacher. He personified the best that is in each of us. That's a lot of what we're asking of people right now, isn't it? The best that's in each of us. Many in Grayson County knew William as a teacher, but he was also a veteran who served in World War II and the Korean War. He was highly decorated, but returned to Grayson County to better the lives of future generations. Jimmy Mattingly, a great fiddler who performed with Dolly Parton and I Saw Playing with Garth Brooks, wrote, "It was a sad day in my hometown of Litchfield as we lost an amazing man, Mr. William Dean Smith, to COVID-19. Mr. Smith was a great music educator for many years in our hometown." William was the first death in Grayson County related to COVID-19, and like so many we're trying to protect, he lived in a nursing and rehabilitation facility. Tonight, we lift up William, his family, his community in Grayson County and beyond, and recognize what a profound loss that this is. It should reinforce our resolve to do our very best every day to protect those around us. We've now lost at least a couple of war heroes. Let's make sure we're doing our part. Let's make sure we're living up to the example that his generation set for us. Let's make sure that we protect people from this virus. William Dean Smith, thank you for your life, for what you have shown and taught to all of us. All right, quick updates on some of the facilities that we have been looking at. Western State Hospital has one new total case, and that is a staff member. I believe we have almost all of the tests back from staff. We tested a huge amount of the staff, and the results coming back were only a handful of positives compared to the overall being tested. That gives us a lot of hope in the facility is where it is now. We hope it's been stabilized. We've seen the numbers stabilize there, and we're really thankful and blessed that most of that staff was negative and can continue to care for the folks there that know them. And we're in a better position to have that same staff working with them. All right, Green River Correctional Complex, we have 7 new total cases. Those are 5 new inmates and 2 new staff that have tested positive. Again, it's not just our senior living facilities, it's any closed facility that when this virus gets in, it can really cause harm. Roederer and Hazelwood, no new cases. And let me just say, while we're working hard here, I want to recognize all of our correctional officers, our jailers, and so many others for running facilities across the state in a way to where we're only seeing something major like this in one facility. Those are frontline workers too, and while it has been really hard to reduce visitation, to eliminate visitation, knowing how important it is for our folks who are in one of these facilities, it was the right decision that has ultimately protected people. Now let's look at our long-term care facilities. This is our challenge. Secretary Freelander talked about it this weekend. We are going to be directing a large portion of our testing capacity that's not being used directly into these facilities, and we're going to be testing now a lot more people throughout all our facilities, because as we've seen and as we've learned, this is where the virus, it's sadly who it comes for. And we got to make sure that we stand in the gap and we prevent it from getting there, and we help everybody that it's affected. We have 22 new residents that have tested positive in long-term care facilities, 12 new staff, and we have 9 new deaths. Now that's higher than the number of new deaths we've read today, and that's because many over the weekend were included in it. Remember, each and every one of these individuals was taken before their time because of this virus, even though there were comorbidities, even though they were vulnerable to other things. The coronavirus stole these people from us. So let's make sure in all of our reopening plans and all of our daily decisions that we know we've got an obligation, an absolute obligation to protect these Kentuckians and every other Kentuckian, and let's make sure that we do our part. All right, we're going to do about, and let me just finally mention, and it was back in our benchmarks, that tomorrow we're going to be providing the link and the method to where different industries and associations can provide some of their initial thinking on what their plans would be. So when we hit that mark, when we hit that 14 days, and we've thought through how we can phase this reopening in, that we don't have to wait an extra couple days by planning then. Let's plan now. We'll do that plan. We'll work with groups on that plan. Just because we get the plan finalized doesn't mean the next day we start, but it gives folks time to buy what they need, whether it's PPE, temperature checks, or others. And so those associations, I know we've had a lot of questions about chiropractors. We look forward to the Chiropractor Association, which reached out to us in a very positive way many weeks back. Send us your plan. Our other folks that have reached out to us in the last couple days, I know our pet groomers that are out there, our boarders, worried about pets, especially for first responders. Reach out to us with your plan. We will work with you from there. And we're already in a couple of talks with folks that want to be able to restart some things, and they're really good dialogue, and it's going to help us make sure that we can do this as quickly as is safe, and that's what's going to guide us. And I think you can expect maybe even by the end of this week, and certainly going into the next weeks in our healthcare industry specifically, we're going to be able to take some steps so people can get some extra care that up to now, as the virus has been growing, was not allowed, or allowed only in specific situations, but we're going to be able to do some things there. All right, we've got today just 2 of our brave reporters. We've got Phil Pendleton and Catherine Collins, and then I've got a set of questions that have come in. So the first question is from the Washington Post. Why is there such a high hospitalization and ICU admission rate in Kentucky, and to what extent does it reflect the challenge the state still faces in getting adequate testing supplies and expanding testing? So one of the reasons that there is a high rate in Kentucky is because we have had limited testing. And what we have done is we have prioritized it for those that are the sickest. So when we get a positive case in Kentucky, it's more likely that that person needs that care and maybe even needs it immediately. Prior to the expansion of testing, which we're seeing, we asked a lot of people that otherwise were going to be okay, but experiencing some mild symptoms or even some real symptoms, but they were going to be okay to be able to ride this out at home and maybe even not to be able to have a test at all. And they are those folks that did that are one of the reasons that we have had the healthcare capacity that's needed to protect people. So one reason is certainly our testing capacity that we had at the time. And remember, it's about a 2-week lag in the positives and then potentially when people get the virus and when they may test positive and then when they still need care. But there's another reason, and that's that we need to be healthier as a people here in Kentucky. We have some of the highest rates of diabetes and heart disease and lung cancer, of asthma, all areas that make people more vulnerable here in Kentucky. And that's a reason as well. And the final is we believe that our doctors are being very proactive, which is really important, especially as we have the beds. I believe they're putting people who might need a bed in one to make sure that we can take care of them. We're a people that look out after one another, and I think those are the 3 major reasons. Catherine?
You talked about reaching that number of testing and how important that is to get as many tests done as possible. Could there be a time where people who are asymptomatic but are not first responders could be tested?
The question is, we want to test more people. We need to increase our testing capacity. Is there a time when people who are asymptomatic, don't fall into any of the tiers, could be tested? We hope that we can reach that time. We hope that we can get to a place where we're there. And it may be that as we talked about the testing and the contact tracing, that's really where we get there, right? As we're able to reopen different things and somebody appears to be symptomatic, we test them, they test positive, we test the people who are in contact with them, even if they are potentially asymptomatic, to try to, again, create that bubble around them. I want to get to a world where everybody who wants a test can get a test. The challenge is the materials that we talked about. Right, we have a lot of capacity. We probably don't have enough capacity to do that just yet. But we have a lot more capacity right now than we can use for tests because of the swabs or because of what's called a reagent for the machines. And so we're out there every day trying to purchase more and trying to get more. But let me say again, our Kentucky facilities are stepping up. I mean, we have some of the national labs that are doing different things, but our major increase in capacity here in Kentucky is almost all homegrown, and we're really excited about that. And for a model that really works for us and getting where we want to get, the more of that we can do, the better. The more Kentucky labs working with Kentucky facilities, Kentucky doctors, Kentucky nurses, the better we're going to be able to be. And we're probably going to have to get different agreements as we have different businesses and industries created where they've got direct ties to places that they can send somebody as immediately as possible. All right. Tricia Mackey from Fox 19 are receiving calls from the tri-state area about small business loans and people running out of money. What can businesses expect? And if Kentucky will receive more money, any thoughts about business and them not having the money right now? The administration of the SBA loan program didn't go the way that anybody wanted to see. I know the federal government, which administered it, wasn't happy. They moved it over to Treasury to try to jumpstart it a little more. And now I think they realize much more help needs to be there. We're all pushing, and I believe we will definitely see another round of small business assistance from the federal government. We need the federal government to provide some more assistance in a number of ways, but we're talking to them on that, and at least they're hearing us out. States and counties and cities are also going to need some very direct help. We're supposed to get our guidance on the first batch of money we received on the 24th, and our hope is that we're going to be able to tell folks a lot more of what we're going to be able to do with it once the federal government tells us what we can do with it, because they haven't provided that guidance. We know we're going to use it for testing. We know we're going to be able to use it for tracing, but we hope that we can provide to different groups and different people some different types of relief, even if it's for all the things that they're now doing, retooling their business to make PPE or to otherwise help us to battle this coronavirus. Phil.
We're getting a lot of emails and phone calls from daycare operators. They basically say that since they were made to close, they have tried to get some kind of insurance, liability insurance or whatnot, and they're being denied that insurance. Do you have any?
The question is on daycares that we had forced to close, and even the White House guidance, has always told us to do that, and in fact even extends it through phase one. That's their recommendations. I'm not sure what type of insurance they're applying for, if it's unemployment, if it's you.
They say it's liability.
Okay. Let me look into that. The question is daycare's looking into liability insurance and not being able to get it. I'm going to need to get you a specific answer on that one. That one hadn't come to me. All right, Al Cross. Given the divergence in publicly available projection models, can I provide an update on what sorts of dates and numbers Dr. Stack and myself are expecting? The estimates are different when you look at it, and the answer is because no one really knows. We're all doing our best. You have a lot of smart people that are modeling it out in different ways. And you got a couple things going on. Number one, you have a disease that none of us have ever seen, and we're modeling like previous pandemics. We don't know that it's going to act just like another pandemic. And I believe in Kentucky and across the country, but especially here in Kentucky, we have the very best social distancing and the most sacrifice to do it that we've ever seen. We are seeing a reduction, a flattening, a plateauing that we haven't seen in the past because of what you're doing. And what that tells me is we've changed the model entirely. And if we can keep this up, if we can be careful about our reopening and how we do it, it won't mean that the models were wrong. It'll mean that you perform better than anybody could have ever foreseen, ever. And I think that's something really special. You want to add anything? Yeah, Dr. Stack.
Sorry, thank you. I agree with the way the governor explained that. I just want to add, because this question comes up repeatedly, so for the media and for those who ask this question, all of these models rely on picking some data set. So how many people die as a percent of the whole, how many people get sick, how many people are hospitalized, how many people are on ventilators, and then trying to use that as a way to predict the other proportions. So if you know a certain percent die from the disease, then you try to say, well, X percent will also go in the hospital and X percent will get infected. All of them rely on that, and the data sets aren't complete, and they vary from state to state depending on how many people test. So the data is not consistent across the country. The more people who get tested, the more the data will average out, and it'll probably be more reliable. But then they all rely on estimations for how infectious the disease is. So how many times one person with the infection spreads it to someone else. Well, like the governor has said, when we do all these social distancing measures, we are changing the infectivity, and there is no scientific way to say with absolute certainty how much we've modified that contagiousness. So when people ask, well, what models are you using? We use them all. We look at all the publicly available ones we can find. We use the ones that we can create internally, and the ranges are very wide depending on the methodology. So I'm just trying to solidly address that question. You can ask all you want for which model we use. The answer is we use every one we can find, and then we overlay that with the best professional judgment we can with our team. So there is no secret or hidden model. it's all of them, anything we can find to inform our decisions.
All right. We'll just do a couple more because I've committed to ending this thing in an hour when I can. Catherine?
Have you heard of any cases related to any of the recent gatherings that we talked about, including that recent protest here?
Have we heard of any cases related to any gatherings that we've talked about? The answer is it's still probably a little bit early. You know, it often taking 2 weeks for it to manifest. What we are now learning, there's some stories coming out of Indianapolis, is a whole lot of mass gatherings result in a significant number of cases. We're learning about, I think it's a basketball tournament right before some of these things went into effect. I think the data is absolutely there. If you have a mass gathering, it's very likely that the coronavirus is being spread. Now, it may be spread from one person who's asymptomatic to another who becomes asymptomatic. But what that means is that it then spreads out through the community. And we continue to see the spread coming in a couple areas in Western Kentucky from one event or one decision that was made that continues to have a ripple effect out. And just one can impact so many different people. When the White House guidance says downward trajectory of documented cases within a 14-day period, that means either the new cases daily or the rate of new cases daily. So it's either our overall numbers dropping if we have about the same number of tests out there, or our rate of positives for our overall number of tests is dropping. Phil?
About graduation.
Yeah.
Watching over the weekend, I think it was Saturday, the Vice President spoke at the Air Force Academy, and it was very interesting to watch where they had all the airmen just lined up on a humongous field 6 feet apart. Do you see a possibility that high schools could do something like that?
I don't. Right now, an in-person graduation threatens the health and the safety of our communities. I know those seniors have been asked to sacrifice a lot. We can't frustrate it by then getting groups together and seeing a spike. We all want to get back to a new normal. I want them, whether they're going to continue their education in a college, a post-secondary, a university, a community college, whether they're going to go to work. I want everybody to be able to be closer to a new normal in the fall, and this is something that would push us backwards. So we're looking at virtual options. I think there can be, if a superintendent thinks it's okay, there could be a drive-in type of option, but an in-person. Sir, I know the Air Force Academy is they can follow guidelines pretty well, but still, it's not something that we foresee being safe here in Kentucky right now. Answered Western State. We tested 124 of the employees. 6 ended up being positive. The last group came in today. All right. Good. All right. Again, thank you, Kentuckians. Your work is saving lives. You are passing the test of humanity. It was never supposed to be easy, but I tell you what, we are more united than we've ever been. And I got something sent to me today. We showed you before, LaRue County EMS. These are people already on the front lines, already trying to make sure we don't lose people, but wanting to honor them every day. This Together KY, Team Kentucky, it's amazing how you've grabbed a hold of it. It's not mine, it's yours. It is absolutely yours. I'm not Team Kentucky, you are. And Team Kentucky is beating the coronavirus. The data is there. You are winning, but this game is not over, and the stakes are too high. So let's keep with it. We'll make our plans. We will reopen our economy safely, but let's make sure that being one of the best states in this country about saving lives, about being one of the most compassionate states in this country, about being the best neighbors, and about loving one another, which we truly do. Let's make sure that we keep this up, because we're going to get through this, and we're going to get through it together. And we've got something pretty special to close with here tonight. This is our own personnel cabinet.
always tomorrow. Lean on me when you're not strong, and I'll be your friend. I'll help you carry on, for it won't be long till I'm gonna need somebody to lean on. Please swallow your pride if I have things you need to borrow, for no one can feel those of your needs that you won't let show. You just call on me, brother, if you need a hand. We all need somebody to lean on. I just might have a problem that you'd understand. We all need somebody to lean on. Lean on me when you're not strong, and I'll be your friend. I'll help you carry on, for it won't be long till I'm gonna need somebody to lean on. You just call on me, brother, when you need a hand. And we all need somebody to lean on. I just might have a problem that you'd understand. We all need somebody to lean on. If there is a load you have to bear that you can't carry, I'm right up the road. I'll share your load if you just call me. You just call